Having me, and I'm very happy to be here. With the first couple of slides that I've done, Jody has pretty much gone over those and done the introduction. I started working with Lyme patients about 10 years ago, and that was before I knew that I even had Lyme. And as people were coming into the office and describing their symptoms, I'm like, this is what I have. And then I was able to get into treatment, and it's been a fun journey. And as Jody had mentioned, that I had tested and the Lyme wasn't showing up. And then this past summer, I was reinfected and had a very big mold exposure. The good thing with that is my system and my body had really recovered and I was much stronger. So this last little leg of being infected seems to have been going a lot easier, and I'm processing through it much quicker. So, just a little word of encouragement to people that as we progress through this and our bodies get stronger, it does become much easier to deal with it. So I'm going to just explain the importance of the lymphatic system and how it's just so important in addressing this system and our organs, especially when we have autoimmune and heavy loads of pathogens. Initially, it's going to be a little more technical and anatomy based, but we're going to get into some images to where it's going to give you a really good overview of the lymphatic system in our body and what we're actually dealing with and working with. So starting out, what is the lymphatic system? It functions like a sponge, and the lymphatic system absorbs excess fluids that the body releases and returns back into the bloodstream. The system contains lymphatic vessels, lymphatic nodes, and specific organs, including the tonsils, the spleen, and the thymus. It produces white blood cells, T cells, and B cells, protein, water, and electrolytes. In embryo, it begins to develop, this is the thymus, it begins to develop at 11 weeks. And the body starts producing T cells at 13 weeks and B cells at 14 weeks. This is important because these are all of our infection fighting cells and our immunity. The lymphatic system is an essential part of our immune system. It eliminates cellular debris, metabolic waste, and toxins. Our gut contains 70 to 80% of the lymph needed to stimulate our immunity. It acts as a waterway system. If one area is congested, it affects how the entire system drains. Regarding the visceral manipulation, this is our organ system. As the heart has its own rhythm, so does each organ. Just as a muscle can get adhesions or scar tissue, so can the lymphatic system and the organs. When adhesions develop in or around the organs, it decreases their mobility, motility, and the vitality, preventing the organs from maintaining optimal function. This imbalance can disrupt the proper pH and hormonal levels needed to maintain healthy environment. The adhesions can develop with chronic inflammation, long-standing pathogens, parasites, surgeries, stress, trauma, and unprocessed emotions. When an adhesion begins to form, the organ can migrate to other organs, tissues, or muscles, restricting the natural movement. Autoimmune and detox. So the image on the right is a really nice image. It's all the green is the lymphatic system, and you can see the areas of the lymph nodes. And then the red up in the chest, that's where the thymus sits. The red on the lower right is the spleen. So we're gonna go into how all this comes together. The lymph nodes and other lymphatic organs like the spleen and the thymus hold special white blood cells called lymphocytes. These can rapidly multiply and release antibodies in response to bacteria, virus, and chronic inflammation. Given the function associated with the lymphatic and the immune system, lymphatic dysfunction contributes to autoimmune disease. This can cause the system to be chronically congested. This means that the lymph becomes thick and it's not flowing and moving through the body. So it's not detoxing optimally. Due to the system not draining properly, it is a contributing factor to why we herx. Our system is already congested and struggling to detox. Adding in kill protocols to the system becomes even more overwhelmed, leading to greater herxing and difficulties detoxing. Okay. So lymphatic drainage and visceral manipulation and how they benefit one another. The lymphatic system and the viscera, the organs, are interconnected. Having optimal flow and function helps maintain the body's mobility, motility, and vitality. It is essential to maintain a healthy homeostasis. This is so important, especially when dealing with autoimmune conditions. So the image over on the right, that is the stomach and then the pancreas. This is a cutaway image, so the stomach actually lays down below. It's such a great image because it shows how the lymph infiltrates through the organs, around the organs. So if there is the chronic inflammation, the lymph nodes enlarge and it tries to isolate certain pathogens. So if they are chronically inflamed, this is what starts to set up adhesions in the lymphatic system and in the organs. So our body has two circulatory systems. One is the red blood, and the other is the white blood, which is the lymph. The red blood has a pump, where the white blood, the lymph, does not have a pump. Instead, there's tiny microfilaments located directly under the skin. They function like gates, moving the lymph forward. If the lymphatic system is congested, it can become overwhelmed, causing adhesions to develop. This greatly affects the lymph flow and its ability to remove toxins and metabolic waste. The lymph is stimulated by deep breathing, muscle contractions, and movement. This can be achieved through any type of exercise, deep breathing, yoga, etc. Upon waking, there's often that feeling of being sluggish or hungover. By doing some of these techniques, this feeling can subside quickly. And that takes place just because the lymphatic system is more in a resting state while we're sleeping, so it's not functioning, it's not flushing out the system. And so we get that heavy load of kind of toxicity and sluggishness in our system. So by doing the deep breathing, a little walking, a little exercise will help to stimulate the lymph and move that feeling out quicker. So then we have the watershed. The torso is divided into 4 quadrants. The upper and lower body are divided at the umbilicus, the belly button, this line here. And that divides the upper and lower body. And then we have the midline, and that divides the right side and the left side. This directs how the lymph flows. So you have the right quadrant, the left, the lower right, and the lower left. How lymphatic drainage is performed. The lymph is located superficial to the skin. Gentle, light, rhythmic strokes stimulate microfilaments that move lymph through the body. Deeper pressure is used in the axilla, the armpit, and the abdominal area. Adhesions that have formed release by manually performing these techniques, allowing the lymph to flow optimally. For each session, the client undresses as they would for any body work and is covered by a sheet. It is essential to be hydrated before a session or always, as the lymph is a waterway system for your body. If you are low on fluids, it dramatically affects how your lymph is moving and draining. The flow of the lymphatic system. Here's just another good image. These are all the lymph nodes. This is the cisternal chyli, which we'll talk about, the spleen, the axillary, the thymus, and then all of the lymph that is up in the head, the jaw, that is draining down. The lymphatic system runs parallel to the bloodstream and is eventually reabsorbed. The route of the lymphatic system starts in the abdomen, and it starts drawing the lymph up from the legs. It travels through the liver, up the cisternal chyli, which runs along the sternum, and into the thoracic ducts. This drains into the heart, where it's reabsorbed back into the bloodstream. Dry brushing is beneficial as it stimulates the microfilaments and increases the lymph flow. Why detoxing is important. When there are genetic components such as the MTHFR, the overall vitality of our body's lymphatic system and organs become congested and inflamed, affecting its ability to drain and detox. When the pathogenic load and the die-off from treatment becomes overwhelming to the system. In addition, there are adhesions in the lymph and in the organs. It will contribute to how well you will detox. Releasing adhesions in both systems will open up the terrain, allowing the body to drain and detoxify. Regarding lymphatic drainage, 3 sessions, 1 a week for 3 consecutive weeks, are always recommended in the beginning. Opening up the lymphatic system is a delayering process. Okay, so we're going to start getting into some more images and specific areas that are affected in the body when it comes to the Lyme and the autoimmune. So the posterior cervical nodes are always a really big part in getting your drainage open. This is the back of the neck. This is the occipital region, and then this just travels down the neck into the shoulders. The posterior occipital nodes are located on the back of the neck, starting at the occipital ridge and travel down the neck into the shoulders. When these nodes become inflamed, it greatly affects how the head and neck drain. It contributes to the chronic stiff neck, cervical muscles, and shoulder tightness, not to mention the headaches, brain fog, and cognitive issues. If you have had whiplash, auto accidents, or neck injuries, this will cause microtearing in the muscles and in the lymphatic system, causing these areas to have more difficulty draining, which can exacerbate any of the conditions mentioned above. The next slide, I like these images because all the blue area is the lymph vessels and then the lymph nodes. So it just gives you a really good idea of how much lymph is in the system and what's really kind of taking place or should be taking place with our drainage. This is an image of the anterior cervical chain. It's located on the front of the neck and on the sides. The anterior cervical lymph nodes are a chain of nodes found on the anterior part of the neck. These travel along the sternocleidomastoid, that's the large muscle in the front of your neck, and down the scalenes, which is on the side of your neck. And these drain down into the collarbone area. If you've had your tonsils removed, ear tubes, or neck injuries, this can significantly contribute to how well your head drains. And that's because of the microtearing that takes place with all of these conditions. So here's an image of the thymus. It sets just about 4 inches, 4 fingers down from the clavicles on your sternum. The thymus gland is one of the main lymphatic organs and is part of the endocrine system. The thymus starts making the T cells and B cells before you are born, and it is most active during childhood. White blood cells, lymphocytes, travel from your bone marrow to the thymus. The lymphocytes mature and become specialized T cells, which help your immune system fight disease and infection. So then we move on to the cisternal chyli and the thoracic ducts. The cisternal chyli is a lymph structure that travels along the sternum and carries the lymph from the abdomen to the thorax. So the abdomen up into the thorax. The thoracic duct is the largest area of lymph vessels. Around 75% of the lymph from the entire body passes through the thoracic ducts into the heart, where it is reabsorbed. The action of deep breathing helps stimulate this process. More people are familiar with these nodes, the axillary nodes that are located in the armpit. The axillary nodes drain the entire upper arm, breast, trunk from the umbilicus, the belly button up, encompassing the neck, the cervical, back, and shoulder. So that image of the watershed that we saw, this is draining the entire upper quadrant, whether it be on the right or the left side. I find that if the upper left quadrant is congested, this tends to contribute to the heart palpitations, fluttering, and tightness in the chest. It can also contribute to how well the head is draining. The bronchial and respiratory nodes. The organs of the respiratory system include the lungs, the pleura, bronchial tubes, and the esophagus. If you have had a history of bronchitis, pneumonia, asthma, or any breathing issues, there is a good chance that adhesions have formed, reducing the vitality of the organ and leaving you more susceptible to reoccurring infections. If you have a heaviness in your chest, difficult breathing, the palpitations, draining the lungs can help relieve these symptoms. Excuse me. So this image on the lower image, these are the bronchial tubes. So the esophagus and then the two areas, they branch off into the lungs. And then the upper area, or the upper image, is just a good image of the lymph, how it flows. The axillary area comes back up, comes down through that cervical chain and in through the lungs. And then we move to the liver. The liver consists of two lobes. The large lobe, it sits on the right side under the ribs, and the smaller lobe is on the left side under the ribs as well. The liver is the body's primary filtration organ, metabolizing nutrients, cleansing the blood, converting toxins into waste product, and eliminating them through the urine. The stomach and small intestine. So this is an important piece, especially for those that have gut issues and why they are so difficult to treat. The stomach moves into the small intestines, but it has several different organs, structures that it has to move through. The stomach has several parts. The main part is the body of the stomach. Then it moves through the duodenal, which is starting to produce more acids and break down any matter further. Then it moves into the duodenal, which is another smaller, thinner structure as it moves through, and then down into the ileum. So when you develop gut issues, it's really hard to determine whether it's in the stomach, the duodenum, the duodenal, or the ileum. And from the ileum, it moves into the cecum. So this is where the ileocecal valve is located. And again, that sits between the ileum and the cecum, hence ileocecal valve. And then from the ileocecal valve, it starts transitioning into the large intestine. If the ileocecal valve is in dysfunction, okay, let me move to the next screen. So again, deciphering the area of where the pathogens are, and then restoring the mobility and motility are quite challenging. The image of the ileocecal here, it's harder to see on the upper image, but you can see how it's moving from the small intestine into the large intestine. The ileocecal valve sets from the belly button down to the ASIS, which is the top of the hip, and it's about midway through on the diagonal. So if you're having IBS symptoms, constipation, diarrhea, this is a good area to address. So this is located in the lower right quadrant of the abdomen, directly connecting the large and the small intestine. It is located between the umbilicus and the ASI, the top of the hip. It is designed to open and close as fecal matter moves through. It becomes in dysfunction, staying open or closed. This can lead to the IBS, constipation, or diarrhea. Due to the natural design, parasites tend to hang out in this area, causing even more inflammation and dysfunction. Then we move to the mesentery root and the omentum. These are somewhat considered organs that most people are not familiar with. The omentum is a protective layer of fat that lays over and between the organs. It has a critical biological function in the immune regulation, and tissue regeneration. It contains hundreds of lymph nodes that help the body trap and fight disease. They also destroy microscopic invaders like viruses and bacteria. This is a good area to castor oil pack, as with the castor oil packing, we'll get into that a little later. The castor oil packing helps to reduce inflammation and helps stimulate circulation. So when you're doing your packing, it's stimulating so much of the lymph flow that ties into the immune system. And it's also helps to reduce adhesions. So the gastric nodes, we've looked at this screen, and it's the stomach and the pancreas. The gastric nodes drain into the stomach, pancreas, esophagus, diaphragm, and part of the omentum. The image shows how the lymph surrounds and infiltrates through the organs. And this type of infiltration is true for each organ. So each organ is surrounded by the lymph nodes, and then you also have lymph that drains through there. And then we move to the deep flow. This is primarily the abdomen. The deep flow is a major pathway for the pelvic region that encompasses the inguinal and the iliac nodes. This area is located between the umbilicus, the belly button, and travels down to the adductor region of the thighs. So the adductor region of the thighs is more of your inner thigh. These nodes drain the abdominal wall, the reproductive organs, the buttocks, the legs, filtering substance such as bacteria, viruses, parasites, and other harmful matter. After a session, you may experience detox or cold flu-like symptoms. If this happens, drink more water, adding electrolytes or herbal teas, doing an infrared sauna or warm Epsom salt bath can also be beneficial anytime that you are experiencing a herx. Light exercise will stimulate the lymph and can relieve symptoms. You might notice an increase in elimination, whether it's urination or bowel movement. Also, lymphatic drainage targets the parasympathetic nervous system, allowing the body to relax. This can induce deeper, more restful sleep and possibly release old trauma. Keeping the lymphatic system healthy, drinking plenty of water, approximately 3 liters a day. Electrolytes help balance the absorption of water and other fluids. So the electrolytes are very important. And the best way to tell if you need electrolytes is that once you drink something and almost immediately you're having to go and urinate, that's a good indication that your electrolyte balance is off. When that's happening, it doesn't matter how much water or fluids you're drinking, it's just running through the system. It's not actually absorbing into the cells and the tissue and really flushing the system. So if you're also having issues with detox, or if you're herxing a bit more, adding some electrolytes into your fluids might help that process a bit. A healthy diet rich in alkaline foods and vegetable provides a full range of vitamins, minerals, and nutrients, including healthy fats. Exercise daily, including both aerobic or anaerobic physical activity. I know sometimes that the aerobic activity is more challenging, but any type of walking, moving, yoga, deep breathing will help to stimulate the lymphatic system, which helps to stimulate the immune system. Deep breathing is very beneficial, as we've covered a bit. There is a breathing guru, and his name is Wim Hof. And he has an app and different breathing techniques, different breathing exercises that you can follow. So that's always a really good resource in creating some good habits around deep breathing. At night, while we sleep, the lymphatic system is in a resting state and therefore not moving optimally. This is why people can wake up feeling very sluggish or hungover. Going in and doing some deep breathing or some movement can clear this feeling much faster. Self-care and detox. So things that you can do at home that help your lymphatic system, help break down adhesions, whether they are in the lymphatic system or the organs. The castor oil packs are really one of the best things that you can do and the cheapest things that you can do. You also have dry brushing, the deep breathing, as we've mentioned, Epsom salt baths, infrared saunas, exercise, the rebounder. The rebounder is also another great tool. And that's just the mini tramp. As you're in that rhythm of just that boom, 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 that rhythm is targeting the lymphatic system, helping to stimulate it and getting it to flow better. There are also the vibration plates and coffee enemas. So these are all things that you can do at home for your self-care. So I'm going to talk a little bit more about the castor oil packing. Castor oil packing, it's been around for many centuries. It's actually, it's hard to find where the origin of it came from. So the supplies that you'll need for your castor oil packing, first off, I just get a basket and I keep everything in a basket together. That way, if you're moving it from room to room, it's easy to pick up and just move. And then you'll have all your supplies together and it's really quick to put together when you're ready to do a session. So the supplies that you will need are organic castor oil and organic flannel, and that can be cotton or wool. So using the cotton or wool flannel, it holds more castor oil and it holds the heat much longer. You don't want to use an old t-shirt or anything that might have been bleached. That's where just finding a good organic flannel is your best option. You would also need a heating pad and 2 old towels. You want to have an old large towel that you can lay on, and then a smaller one that you will put between your castor oil pack and the heating pad. You'll want to have a roll of paper towels as the oil is very messy, and then baking soda for after your session that you will rub into any oil that's left over, and then you will shower that off. So tips for castor oil packing. Castor oil is not water soluble. So anything that you get it on, it will be very, very difficult to get it out. And it will not dissolve with just soap and water. The other thing to be aware of is it has a very low flash point, meaning it catches on fire easily. So you would never ever want to put a castor oil pack in a dryer. A flannel cloth will last about 20 to 30 sessions. You will notice when it's time for a new pack as it will start to get rancid and just a little bit funky. Store the flannel in the refrigerator if you're not going to use it regularly. This will help extend the life of the flannel and keep the oil from going rancid. If you have not used a flannel in some time, you will want to get a new flannel. Rubbing baking soda into the area when you're finished will help to, the abrasiveness of the baking soda will help to break down the oil. Then you can just get in the shower and wash off the remaining bit of it. Always store the flannel in a glass wide mouth jar. If stored in a plastic bag, it can absorb some of the chemicals from the plastic. If you have insomnia, doing your pack when you wake up in the middle of the night can always be beneficial. Most of the time, people will return back to sleep. And if you want to do it throughout the night, you can also do that. So with the castor oil packing, to do a session, a 1-hour session is ideal. But for sensitive people, start with 20 to 30 minutes and increase the time by 10 minutes each. If you want to go longer than an hour, that's not a problem. If you want to sleep with it, that's also an option. Anytime I have recommendations for people, I always have them start very slow if they're sensitive. It's easier to work up and add time than to have a big herx and need days to recover from that. So that's where, if you tend to be more sensitive, start with 20 or 30 minutes. And a lot of this is just, there is no right or wrong way. A lot of it is just using your intuition. Do one session daily for 3 to 5 days, consecutive days. If you can't do consecutive days, anything is better than nothing. By doing this for the consecutive days, you just get that more concentration and benefit of the session, and it helps to break down the adhesions. You just get some better results regarding breaking down the adhesions. In starting the castor oil pack, I always have people start with the descending colon, which is located on the left side of the abdomen, placing the flannel vertically over the area. This will open up the colon, creating a pathway for your body to release toxins. This might also stimulate a bowel movement. And again, there is no right or wrong way. Follow your intuition on what's best for you. And depending on what your goals are, the pack can be placed anywhere on the abdomen. So I can't stress enough of starting with the descending colon, because you want to create that pathway for things to move out. Sometimes people will start with the liver or other areas, and that can create a big herx because of all the toxicity that the liver carries. If you just have a big dump into your system and the colon isn't moving things out, that can also cause another big herx. So I tried to put some images together here. The left side is your descending colon. And when you start with when you place your castor oil packs, you want to take it up as far under the breast as possible, and then take it all the way down to the hip bone again. Starting at the top, you're going to target the pancreas, the spleen, which is so important, the descending colon, and as you bring it down lower to the hip, it's getting the inguinal and the iliac nodes, which is starting to help drain the abdomen and stimulating the lymph, stimulating all the immunity and the lymph in the abdomen. So again, start at the breast, take it down to the hip, and this will help open up the colon and release the pathways. This will open up the colon and start releasing the toxins. My apologies, my brain is getting a little tired. So another way you can do your castor oil packing is draping it under the breast from side to side. And this is targeting the transverse colon. So you have the ascending, the transverse, and the descending colon. In doing it horizontally, you're getting both lobes of the liver, the kidneys, the transverse colon, the pancreas, and the spleen again. So moving on to the next slide, this is the ascending colon. And by placing your pack on the right side, this targets the liver, the ascending colon, the ileocecal valve, the cecum, and the appendix, which is another organ that filters a lot of viruses, infections, bacterias. So that area down below is always good to kind of target. And you're getting the iliac and the inguinal nodes and starting to stimulate the omentum and the mesentery nodes. If you place your pack on the lower abdomen, you're getting more of the iliac and the inguinal nodes. You're getting more of the reproductive organs and the bladder. So you can see that there is no right or wrong way. It kind of depends on the area that you want to target, and follow your intuition. It can guide you probably the best. Another area that you can place the castor oil pack is just directly over the abdomen. This is getting the small intestines, the omentum, the mesentery root, the bladder, the uterus, and then as you go up towards the sternum, the kidneys, and some of those other organs that we talked about. And then this last slide that I have is just some good images. The one on the bottom right, this area shows all the lymph and the lymph nodes that hang out. This is just in front of your ear and down slightly. Behind your ear, there are also some lymph nodes. And then this will drain down the scalenes into the clavicle area, and it also targets some of those posterior cervical nodes. And then in the submandibular, the lymph nodes that are under the jaw. So these are really important if you're having the issues of getting your head to drain, or if you're having any of the dental work. One way that I can notice if my head is more congested, the nodes behind my ear, when I wear my glasses, that area feels a little more irritated and like my glasses aren't sitting quite right. That's a good indication that your head is not draining as well as it could. The image to the left is just more of the cervical nodes, the scalene, and the SCM nodes, and just giving you an indication of where some of them are in the neck. And they're all listed here. And then the upper right image, that's just some of the areas that you can palpate to start getting your lymph to drain up in the head more. Unfortunately, I didn't have time to kind of do some self-care of how to stimulate these nodes, but hopefully I'm intending to put a little video together of how to do some of this self-care on your own. So basically, with just the flat palm of your hand and some of these areas indicated, you just want to do a very slight, gentle stroke up, kind of behind the ear. And you can also do a circular motion, and that will start draining the lymph around the necks, just with either a straight motion or circular motion, you can just start moving along this chain and bringing the lymph down. So hopefully I can get that done, and then Jody can get that posted to the site and help with some more care for yourself, self-care. Okay. So that wraps up the presentation, and I'm happy to answer any questions that you might have.
Thank you, Karen. So if anybody has any questions, feel free to put them in chat and we can have a Q&A session. And while we're waiting, Karen, I actually have one for you that came to me. And that is there a possibility, have you ever had an awareness or possibility of over-detoxing, where a body is getting overstimulated with over-detoxing and issues that might cause?
I can't hear you very well, Jody. You're cutting out quite a bit.
Can you hear me now?
It's still like a lot of feedback.
All right, you know what? I'm going to post it in chat, Joanne. I'm going to have you read it.
Okay. Okay, Karen. Jody's question is, have you ever found cases where someone could be over detoxing, where their body is unable to handle?
Yes, so I guess that can be a fine line of if your body's not detoxing or if you're detoxing too much. So let me think of some situations. So for instance, like with the castor oil packing, if you're really sensitive, starting with a lesser amount of time and just seeing how your body reacts to whatever you're doing. There's a lot of detox tinctures, things of that nature. And again, I usually recommend that people start with about a fourth of the dose and gradually work up instead of the full dose, because you can hurt from detoxing too quickly just as much as you can from your body really not draining or detoxing. So it's a kind of a fine line, and that's where I think using your intuition, knowing your body, and just starting slow to see how your body responds to things.
Okay, is there any other questions for Karen today? You know, Karen, I do have one for you, if that's okay.
Yeah.
So I have a therapist, but she only does lymph and cranial, but then I have to go somewhere for visceral, somewhere else. Is it better if you haven't done all in one session versus having to break it up a little bit?
You know, those are kind of always challenging questions.
Okay.
Because there is no right or wrong answer to that. Again, it's kind of your body. One thing that I find, and this is considered manual lymphatic drainage, because it's moving the fluid through and working on reducing the adhesions. I've had some people who have tried doing like the lymphatic compression or machines on the lower legs. And typically what I have seen and what people have experienced, that it's moving a lot of lymph, but if your system isn't open and draining really well, then it's just moving it into areas that it can't drain through. Having the cranial is always such a good thing because that is opening the lymph and draining it. But if you have the adhesions, say in the abdomen, where is that lymph going to flow through? So I think for anyone starting the lymphatic drainage, and especially at home with the castor oil, is doing the abdomen first, because that is where the largest amount of the lymph collects. So once that's open, then all the other areas have a place to move through. If I had a client that just went in for lymphatic drainage and they just did her face, so her face just blew up because the lymph was stimulated, but it didn't have the ability to move through the rest of her system.
Okay.
So
All right.
does that answer your question?
It does. It does. Thank you. And it looks like we have another question for you.
Okay.
Let's see. You mentioned that you recommending started with 3 weeks of lymph massage treatments. Can a lymph mold patient expect to have a response in that amount of time?
So I believe the question is that what kind of results are you having within that 3-week period? So the 3 weeks for the lymphatic drainage, that's recommended for anyone, whether you're having autoimmune conditions or not. And the lymph, if your system is congested, it can just take a bit of time to delayer it and to get everything opened and draining as readily as possible. Because usually there is some area that needs a little more attention than another. So when it comes to starting some lymphatic drainage and how many sessions are needed, that's always the $1,000,000 question. When I work with clients, we start with the 3 sessions. About the second session, I start having a conversation with people of like, are you noticing a difference? Do you feel like this is benefiting you? And, how is this benefiting you? And really working with the client on the responses that they're having. If I feel like their system is really congested, and this can also, what plays into this is how long have they been dealing with issues, how well their system is responding, detoxing. And if I feel that they need another 3 sessions, I will definitely recommend that. Typically after the 3rd session, I like to have the clients very engaged with their care and what they're doing, what their goals are, and honestly, what people can afford, because I understand firsthand of how expensive treating these illnesses are. So to really optimally understand how this is working and how your body is responding, the 3 sessions are really the best. If you just do 1 session, I don't know if people will have a response. How much of that they notice is dependent on each person.
Okay, looks like we have another question from Allison. She wants to know if you can recommend the detox tincture you mentioned.
I know there's 2 that are really popular, and it's the Lymphiness and the Iteries. And typically you have to get those through a practitioner.
Okay. Are you taking new clients, and can we share your contact information?
Yes, I am taking new clients, and yes, you can share my contact information. And if even people have any questions more specific and want to speak privately, I'm always open to, having them call me and just discussing what they feel their needs are and what they're struggling with, and if this is actually something that would benefit them.
Would you mind putting that in the chat for everybody? I don't actually have that information.
I got it, Joanne. I got it.
Okay,
Perfect. That would be great. Somebody can do that. We have another, let's see. We have another question from Allison. Do you have an opinion on dry needling? Is it better to do lymph massage before or after dry needling? Thank you for all the helpful information. Appreciate your expertise.
oh, so I guess my first question would be, what are you dry needling for? Is that for more of the lymph system, or is that just tight muscles and injury purposes?
Allison, can you put that in the
Hi,
chat?
you're asking? Yeah, it is for everything, all above. I know I did have a car accident, but I didn't even link like the pain, it was kind of like a whiplash situation, but I didn't really get the pain right away. And
Mhm.
so I don't know, so I have a ton of tightness there, but I feel when I get it done, it does release. I have had feeling kind of rotten after it, but it's in the like shoulder area.
Yeah, so that with the way the Lyme sets up in the brain and all of the
Yeah.
information, let's see if I can go back to that image.
Yeah, I never really knew how much of it was from Lyme or from that. I did go to a chiropractor who really thought a lot of it was from this car accident years and years ago. So I don't know.
Yeah, so the way those tie in together, and this is such a great question, and so you have the auto accident, you get the micro tearing in the muscle, and you get the micro tearing in the lymphatic system. So in all these little lymph nodes, and in between the vertebra are lymph nodes. And because of that chronic inflammation, that lymph, and then you get the adhesions or it scars over. So that lymph isn't able to drain. And you go to the chiropractor and they adjust you and they adjust you, and it still doesn't really, it's such a temporary relief that you get with the lymphatic drainage. What I find, and before I got into just specializing in this, I used to specialize in auto accidents. By going in and draining the lymph and the inflammation from the whiplash out of the area, really starts opening up the brain, how well that drains, the chronic stiffness in the neck. I can not only drain in the lymphatic system, but also in the muscles and tissues. So people that have had these auto accidents, and the trigger points in the neck and the trigger points in the shoulder, doing the lymphatic drainage can be very beneficial. And then also I can drain around the attachment sites, the ligaments, to just start helping the neck having more mobility and decreasing some of this chronic stiffness and discomfort and pain, basically. So regarding the dry needling, that is just always something that I have people try and see what works best for them. Because there isn't really a right or wrong way, it's just how your body responds to it. The other thing I might add in there is some trigger point injections might be beneficial for this. And at the Sound Clinic, I don't know if I can say that, Dr. Krems, I have had numerous auto accidents, like 10.
Oh man. Well,
And he does trigger point injections with homeopathics, and he will muscle test to see what the best solutions are, but he also follows that up with ozone therapy, ozone injections. And the reason I like that so much is the way Lyme likes to set up in the ligaments and the hard tissue. When you start getting this type of patterning and more scarring and more denseness in those ligaments, to have the ozone flush that out, I have found to be just so beneficial.
What was the doctor's name?
Dr. Josh Krems, Krembs.
We put that in the chat for you, Allison, and
I
also,
saw Sound Clinic, but I didn't catch the doctor's name.
yes, above
You
it.
put it in.
Yeah,
Thank
Joshua
you.
Friends.
Okay. Thank you. So would you think though that you should do a lymph massage following a dry needling session or before you go for the dry needling, which would get things moving better?
So regarding the dry needling, I would say maybe doing the lymph prior, like a couple of days prior, because that's going to start opening up all that tissue and draining the area.
Okay. Makes
With
sense.
with the dry needling, I know personally I've tried it before. It just seemed to irritate more of my conditions.
Oh, really?
Well,
it felt really good to me, actually.
and again, everyone's different, but my nervous system is so twitchy and
yeah, it was like painful, but in a good way. I don't know. It just kind of released a lot of, but it felt like it released stuff too. I felt it kind of wiped out afterwards. I don't know.
Well, and it could be releasing a lot of the toxicity out of your system to where you're getting a heavy load of kind of like die off or, toxicity release in your system.
Yeah, just right in that one muscle where the dry needle goes, I guess.
Yeah.
So
the other thing that you might do is do some castor oil packing prior and then do some castor oil packing after. And then that way your system is open and somewhat prepared for the dry needling. And then after the dry needling, as the castor oil pack is opening up, bringing in circulation and helping the lymph to drain, that might help ward off some of those herxing, feeling wiped out afterwards.
Okay, so are you saying do the castor oil pack like before and after you go for the massage, or?
Yeah, the castor oil packing is just a good thing to work into your routine on a regular basis.
Okay, well, very helpful. Thank you.
You're welcome. And to get set up with the castor oil packing, aside from the heating pad, it's about $30 to get everything together that you need. And that will last you quite a while because you won't be using a full bottle of the oil. The pack you'll use 20 to 30 times. So for $30, it really extends out for quite a while.
Okay. Yeah, I bought one of those Queen of Thrones pads, but I didn't really know how long it would last or how long I should keep it for. I guess just
I have purchased one and I have not tried it. A couple of things that I'm not sure of, and it doesn't mean that that's wrong. The couple of things I'm not sure of is that she doesn't have you apply heat. It's really the heat that creates the deep penetration of the oil. I mean, yes, your body heat will warm it up to some degree, but even with just regular castor oil packing, I've found that hot water bottles don't stay warm long enough. They don't get warm long enough, warm enough or stay warm long enough. The little microwave bags, again, kind of the same thing. Typically it's recommended that you always kind of avoid a heating pad because it tends to dehydrate a muscle and create more adhesions. But with the castor oil packing, you are, the oil is a lubricant and the heat, and since the focus is breaking down the adhesions, you don't have that concern of when you're just using it alone. But I think having the higher, more direct heat is more beneficial. The pack that I received said, oh, wash this. And I don't know if it said put it in the dryer. But again, if you wash that, I can't imagine what kind of mess you would end up with because the oil is not water soluble. So those are my only things that kind of kept me from proceeding forward with those packs.
Okay, so we
Thank
have
you.
sorry. We have one last question. It looks like from Jane. Karen or someone mentioned a cranial sacral practitioner. My daughter is having facial surgery. She has Lyme. I'd love a recommendation if you have one.
So Joanne, if you have your person, you could recommend that. That's a class I'm going to be taking at the first of the year, but I don't offer the cranial sacral at this point.
So my person is moving at the end of the year. She's not taking new patients. However, I have a recommendation from her for another practitioner. I have not personally seen her, but she highly recommends her. So I will put her name in the chat for you, Jane.
And depending on the type of surgery your daughter's having, the lymphatic drainage might be beneficial. And again, it's opening up so many of these posterior cervical nodes, the anterior chain, the submandibular nodes. And again, if the whole system isn't really draining, you know, I can't speak to that. So, but I know it is very effective.
Does anybody have any other questions for Karen today? Okay, doesn't. I'm not seeing anything. Let's see. Okay, yeah. Okay, doesn't look like anybody has any questions. Any other further questions for you, Karen? Thank you so much for your wonderful presentation. I learned a lot today. We really
My
appreciate your
pleasure.
time.
And again, if anyone has any questions and they want to just reach out to me, I'm happy to speak with them.
Okay, sounds good. Thanks so much. Okay, friends, just want to remind you that we will have our next meeting on December 3rd. It will be at the South Glen Library, and it's more of just a holiday party to get together, and it will be from 2 to 4 p.m. And we will have information on that on Meetup and also on our Facebook group, Colorado Lyme and Tick-Borne Disease Group. Everyone have a great weekend.
Thank you all. Bye-bye.
Bye.